Hello, everybody, and welcome to today's Facebook Live. My name is Renza Shibilia, and I'm here from Diabetes Australia. Before I start, I'd like to acknowledge the traditional owners of the lands on which we're meeting. I live and work in beautiful Wurundjeri land, and I wish to acknowledge the Wurundjeri people as the traditional owners. I'd also like to pay my respects to their elders, past, present, and emerging, and to any Aboriginal elders who might be watching us today. So today I am joined by Associate Professor Neale Cohen from Baker Heart and Diabetes, and we're here to talk about something that is super topical, and that is COVID-19 vaccinations and diabetes. Welcome, Neale. How are you today?
Hi, Renza. Thanks very much. Yeah, thanks for having me. I'm very well.
Oh, thanks so much for being here. Tell us a little bit about yourself, Neale. What do you do? Who are you?
So I'm the Director of Clinical Diabetes at the Baker Heart and Diabetes Institute in Melbourne. So we have a big clinical service and research centre here in Melbourne, and one of the largest diabetes services in the country, I guess. So, and we run a lot of clinical trial work that we do here as well with new therapies for type 1 and type 2 diabetes.
Absolutely. Now, the COVID vax and diabetes topic is one that keeps coming up on Diabetes Australia's socials, in so many diabetes online groups that I am a part of. So we're thrilled that as our vaccine rollout here in Australia has now started, we thought we'd jump the gun and we'd get in and we'd ask you some pretty hard-hitting questions about how, about people with diabetes and the vax, and should we be going and getting our jabs? And I think there's a one-word answer to that, isn't there?
Yes, the answer is yes. I think so. I think that it's obviously very topical. People are anxious about what this means and if it's safe and effective, and I understand that. I would put it in a similar category to the flu vaccine. This is a nasty, dangerous virus that no one wants to really get, and people with diabetes are at increased risk, not of catching it, but certainly of bad outcomes. And I think that's the key message.
Yeah, absolutely. So we know that to start with, there will be 2 vaccines available in Australia. The Pfizer vaccine started being rolled out last week. And I believe today there was an announcement to say that the AstraZeneca vaccine that's coming to the country has all been batched, and it will be starting tomorrow, I think, in South Australia. Tell us about the 2 different vaccines.
Well, I mean, I must say I'm not an expert in vaccination, but there are differences, and we believe the Pfizer vaccine is slightly more effective,
okay.
And whereas the AstraZeneca so far looks slightly less effective in preventing infections. There are differences in storage. So from a practical point of view, the AstraZeneca is actually easier to administer its storage. It doesn't require very cold storage, so it's easier to roll out in general practice, and it's cheaper, I think, as well. So, so there are logistics around this too. I think that, honestly, I think it's going to be a long time before we know which is necessarily better and safer. I think there's a lot of data emerging around the world, but I'm not sure we're going to have much choice for most of the population as to which we receive. But I think they're effective vaccines, and when you think about the flu vaccine, it's not by any means 100% effective either. So certainly they're in that ballpark anyway.
Absolutely. Now we've got some questions coming in, and we will get to them. So I just want to say to everybody that, as I say every time we do one of these Q&As, they work best when there are lots of questions, and I can see that there are questions coming in. We'll get to them in a minute, but I just wanted to ask about, so one of the really big concerns that people seem to have in the groups that I've been looking at, and is they seem to have become available very quickly, and that they haven't been tested on people with diabetes. So that's actually a real concern. So when people are being asked, are you going to get the vax? Some people who are a little bit, they're not saying no, but they might be hesitant to get it once it's offered, as soon as it's offered, because they think that people with diabetes haven't actually been part of the trial process. Is that true? Or
No, I mean, there's been large-scale trials. They haven't targeted people with diabetes, but there's certainly been people with diabetes involved in these trials. And of course, many of the older groups have type 2 diabetes as well. So they have been. There's no reason to think that these have any safety issues in patients with diabetes. Again, I come back to the flu vaccine, where we recommend these vaccinations. There's never been any signal that people with diabetes are more at harm or more at risk or have any special circumstances. So I think we're confident that there's been enough clinical work done, and it's now being rolled out to, I don't know how many people, tens of millions around the world, and we're really not seeing any major reactions or concerns. That will evolve, but I think we're quite confident at the moment there's no special issue with diabetes.
Yeah, I've been watching carefully. It sort of is becoming a rite of passage, I think, for people with diabetes when they get their vaccination to share that news on social media if they're active on social media. And it's really interesting to hear people talk about how they're feeling afterwards. And most people are saying a bit of pain at the injection site, which I think most of us probably experience after we've had a flu vaccine each year or any other vaccination. Some people have felt absolutely no different. Other people have said, I needed a couple of Panadol because I was feeling a bit achy, but within 24 hours, I've been back to normal. Is that what we can probably expect?
Yeah, I mean, these are classic side effects, if you like, of vaccination. You get an immune response. Your immune system gears up, you can get a temperature, you can get fever, chills, aches and pains. And that's how it works. That's a sign the immune system is gearing up and producing things that give us temperatures and ramp up the immune system. So that's normal. We're not seeing anything out of the ordinary, I think, so far.
Could having a vaccine affect our glucose levels short term?
Again, I think it's anything that causes disturbance of the immune system or makes you a bit unwell or feel lousy, cause a slight increase in glucose. There's nothing specific about this that I think we're concerned about, but if you are feeling off colour for a few days, it is possible that you might have an increase in, say, cortisol in the body, and that might disturb your sugars. I think these are going to be small effects. Again, we're not getting signals that anyone's having major disturbances in their glycemic control.
No. So it's one of those things that, I guess after anything that's a little bit different, check your glucose levels more frequently, keep an eye on them. If there's anything you notice, pick up the phone and have a chat with the GP. Is that?
Absolutely. It's sick day management, if you like. You might be a little bit sick for the following few days.
Okay. All right. Let's go to some of these questions that are coming in. And a lot of them actually are, when are people with diabetes going to get vaccinated? Where are we in this rollout? We have a very clear rollout. There are different phases. We're currently doing phase 1A, which is quarantine workers, aged care workers, people living in aged care, and some frontline health workers. Yep. Where are people with diabetes? Where do we fit?
So they're in the next rollout, really. Predominantly, people with chronic illness fit into 1B, as far as I understand, and so that's the next rollout. That'll be other healthcare workers as well, perhaps such as myself, and so that's phase 1B, and then there's other groups as well according to age and other risk factors. So it should be in this, what we call the phase 1B rollout, as far as I understand. I think details are a bit sketchy is exactly how this happens, but that's the plan.
Yeah. So our recommendation would be there are great websites to keep an eye on. So obviously Diabetes Australia, Baker's website, and of course the COVID website from the government. There is currently an eligibility criteria calculator, and you can put in your details, and it actually does say underlying health conditions, diabetes is included, is in 1B. So that's what we're seeing available at the moment. Of course, if there are any changes to that, we will be reporting that as soon as we see them. But for all information that's available at the moment, that is where to find that. Okay, now somebody's asked a question. This is interesting, and I'm not sure, Neale, but somebody has said that their daughter, her concern regarding the vaccine is fertility. Is that something we know? I know that it's often we might not be sure about this. What do we know about it?
Yeah, I don't know of any evidence this affects fertility. I think that women of childbearing age are encouraged to have this vaccination. There's some concern perhaps if you're pregnant, there's not certainty over that, and breastfeeding, but there's no evidence that I'm aware of at all that this affects fertility.
Yeah, and again, that's another one that we would suggest that people speak with their GP or with their obstetrician or gynecologist about these sorts of questions, and see what they have. But yes, we certainly haven't seen anything either. Now, somebody's asked about children with type 1 diabetes, because it seems up until now it's only adults, or I think the Pfizer vaccine is 16 and older. Is that right?
So there's 16, I think AstraZeneca is 18.
Yeah.
So they're not approved for use in children at this stage. So that may change, but I think the evidence is that children don't seem to get too sick with this anyway so far, but at the moment they're not approved for that use.
Yeah. Now, there's been a lot of questions about what's this process going to look like? How, who do we roll our sleeves up to? Is it our GP? Is it in a community setting? Is it our pharmacy? Do we still need to wait and find out? Because that seems to be one of the pieces of information that for the larger rollout, which is, I guess, 1B, that it's a bit sketchy at the moment. We don't have all those details yet, do we?
No, we don't. And I think that, they're concentrating on the first 1A group. And I know that you have to apply to be a vaccination centre, and that is presumably still underway. I think there's a lot of applications and being assessed, and presumably be largely through general practice that will take on this role.
Yep. Now, with the timing of all of this, it might be that some people are invited to have their COVID vax at the same time as flu vax season. Is that something that can happen at the same time, or how's that going to work, do we think?
Again, my understanding is you need to have a gap between the two, and I believe it's 2 weeks. I'll have to confirm it, but you generally, they don't advise you take these at the same time.
Okay, that's good to know, because I think actually there will actually be quite an overlap between the two. So, again, this is one of those questions that your GP clinic will be, I'm sure, answering a lot of and making very, very clear in any of their notifications as well.
Yeah.
Now, this is one of the questions that's come up, but it is explained on the website. Is it says that people with diabetes or people with any underlying condition will need to prove or have a letter of proof or a letter from their doctor or something about that they are eligible. Have we got any idea of what that might look like? It could be our NDSS card. It could be the GP clinic has all this information on record anyway.
Again, I think this will come through the general practitioner who should have that information. I am not aware, and I'm being asked this question quite a lot, of course, by my own patients, and I'm not aware that I need to provide any extra evidence, but I'm hoping not, because that will mean we'll be printing out thousands of letters, of course. But yes. I think that, again, if this is done through your GP, they should have this information. Now, it may be that certain high priority groups need some sort of certification, in which case we'll have to provide it. But I think in general, the GPs will handle this. Okay.
Now, we've got a comment, and I'm wondering, perhaps this is a good one to think about how we would react to, loved ones or friends or anyone that we see who's saying this, because I'm hearing it a bit. Somebody has said that they're waiting to see if there are any side effects before they get theirs.
Okay.
What would we say?
Well, again, I think we have to rely on international data here. That, again, there's tens of millions of doses already been administered. They report everything, of course, and so far, you look through the literature and it really is showing what we're expecting. We're seeing the usual inflammatory responses and nothing much in severe allergic reactions. And so, I think, I'm not sure how long people want to wait. Of course, there's always concerns about long-term safety. We can't answer that question, but most reactions we would expect with vaccinations are short-term. And if there's anything long-term, it'll be some time, I think, before we can have certainty. But I guess you have to weigh that up with the risks of catching the virus. And so, if you want to wait, that's okay. But then you have a risk of catching the virus and the consequences of that. So, look, in some ways, I understand people's concerns about long-term issues. I'm pretty reassured so far, but you can never be 100% certain about long-term effects. I think it's fair enough.
Absolutely. And of course, we also need to weigh up that risk of passing it on to somebody who hasn't been vaccinated yet, but is still quite vulnerable. So
that's right.
There is that responsibility, I guess, as well, that I know I always personally think about when it's time for a booster or to be vaccinated, and have these conversations with my 16-year-old daughter who thinks that it's okay to tell her mum with diabetes that she doesn't want to have a needle. That
Yeah.
doesn't work well in this house. But I think you're right. We do need to understand that people might be feeling hesitant, but there is a lot to be reassured about. That this has already been rolled out in really huge numbers.
Yes.
Now, one of the concerns people have is that they say they don't want to be injected with a live virus. There's no live virus in it.
So this is not a live virus, no.
Yeah.
So you can have immune suppression. You can be in a high-risk immune group, but still have the vaccine. Whether it's as effective in that group is the only slight question, but it's not a live virus. So again, we can be reassured that you're not going to catch, you don't catch the virus from this.
There is information on the Department of Health website, the COVID website, that talks about what is actually inside these viruses. So any of those sorts of concerns about there being, mercury or any other hard metals or whatever, you can certainly have your mind put at risk, because all of that is very clearly explained on the website. Now, this is an interesting question that we've got. Somebody's asked, what's the effect on people with multiple autoimmune diseases who are on insulin, but also on immunosuppressant medications? Is that, where would we sit with that?
So yes, I mean, this is obviously a high-risk group for morbidity, but if there was an infection in such a person, depends what the other conditions are exactly, but they would be at high risk of having an adverse outcome from a COVID infection. Can they receive the vaccination? Absolutely. Yep. Again, it's autoimmune conditions are quite specific conditions that target specific organs, but they don't necessarily affect the immune system as a general system. Mm-hmm. So you can absolutely have the vaccination, and I've obviously got patients like this, and my advice is absolutely go ahead, have the vaccination. You're in the high risk groups.
Yeah, absolutely. Now, with both of these injections, it's a 2-jab process. So there's what's the wait in between? Is it the same? I'm not sure if it's the same or if it's...
Yeah, a good question. And I might have to defer to the website. I think it's 6 weeks from memory.
Okay. So somebody, though, has asked, do we get some form of protection from the first injection, or do we need to have both doses for that to happen?
Again, if you read the information, you get some protection from the first injection, but you're not, there's uncertainty about how long it lasts, and it's certainly not as effective. So, you should, like all these things, have the full course.
Yeah, absolutely. And I think that's really important for people to remember, that there are the 2 shots that you need to have, and to make sure that you go to that second appointment as well. Yeah. Now, we did touch on the flu vax. So if I have a COVID vax, I still need to get my flu vax, right?
Yeah, different viruses, absolutely. So all the vaccinations that you would normally have, you need to keep having. They're quite separate and different viruses. And if you get the COVID vax and don't have the flu vax, you get a nasty flu. And so, of course, we have to remember the flu is a nasty infection for people with chronic disease as well. It kills people as well. I don't want people to forget about that. I think that we need to be protected, particularly our patients with chronic illness need to be protected from these viruses.
Yeah, definitely. We've got a question from Rachel. She says that after being vaccinated, should a person with diabetes wait longer than somebody without diabetes before travelling overseas? And she does add, when Aussies are able to. It's really hard to travel overseas at the moment, but once borders are open and we can get on a plane again and go to far-flung places.
To travel. So no, again, there's no evidence that there's any reason to wait any longer at all. So presumably you're going to get a passport with a vaccination certificate on it of some sort. But I think once you've had it, that's fine.
Absolutely. Now, I know that there are lots of questions about what happens once we are all vaccinated. It doesn't mean that we can stop thinking about the measures that we have been doing now for 12 months, does it? We still need to consider remaining socially distanced and washing our hands, at least until we have a lot more people vaccinated. Is that?
Yeah, I think we talk about herd immunity, and once we've got general immunity up to a reasonable level, at least we know that there won't be rapid spread, but it can still exist. And I suspect this will be a problem for maybe 10 years, that we open international borders, we're going to get cases. The good news is they won't spread like wildfire, and I think it's just a highly infectious condition. And the problem with that, of course, is it can overwhelm health systems and cause terrible illness and death. So, I think the reassuring thing is once you've got a degree of herd immunity, at least that we could be confident that we can track and trace people and not get an outbreak.
Yeah, and our national rollout is currently flagged to be done by October. So that's pretty impressive. So at least we know that.
Yeah.
There's still no news necessarily on when our borders are opening. So we may have that level of safety, I guess, in Australia. It's just once borders are open and once we're travelling as well that we need to be more mindful, I guess.
We're lucky, aren't we? We've got no new cases, I think, in the country. It's pretty good. But no doubt we will open international borders and things will change, I think.
Yeah. We've got a question from Josh. Josh says that Josh has type 1 and also works at a local port. Who can you call about the vaccination to see which category you're in? So on the website, and Emily might pop this in the comment section, there is a vaccination eligibility calculator that will tell you which phase you are in. And one of the questions, they list certain jobs. And so if you meet any of those, you might be in 1A. But if it's just diabetes, it's likely that it will come up as type 1B, Josh. But if you go to the COVID vaccine websites and have a look, there are contact numbers and you can give somebody a call there. But Emily will put up the details perhaps of the calculator there, which I keep doing. I don't know why I keep doing it. The answer keeps coming up the same. But I think that seeing people overseas having theirs, I'm really ready now for this to be rolled out for people with diabetes in Australia. Now, we go to the GP or wherever it is that we're having our vaccine. What's the process? We have the vax and then it's like any other vaccine, right? You have to wait for a bit.
Yeah, I mean, we have, I think it's a 15-minute rule. So once you have vaccination, you need to sit to make sure you don't have any sort of reaction to the vaccine. So that's all there is to it. It's really not much different to what we experienced with the flu vax. I think there is a mandatory 15-minute waiting time, which I don't think we have with the flu vax actually, but it's sensible. You'll just sit there and make sure you're feeling well, and then go home. Yeah, absolutely. Okay, so great question here, and I've been asking this as well. So, is COVID-19, as we know it, is it likely to change? Is it going to? Well, we know that there are already different variants of it, but will this mean that we might need to have another vaccine or a booster later on? I know that we probably don't necessarily have all of this 100%, but is that a possibility? Yeah, well, I think probably need to ask an infectious diseases physician, but my guess is that this will be something you'll need to be getting boosters for. Again, the flu vaccine you need every year because it changes. We get mutant varieties quickly, and this is looking a bit the same. So that would be my basic answer to that question. It's pretty likely, I think, we're going to need regular COVID vaccination. Now, Karen wants to know, why can't this be done in one injection? Now, I think this week we've heard that the Johnson & Johnson injection that's just been approved by the FDA in the US is a one-shot vaccination process, but not these ones. What do we know why? I don't think I can give you a sensible answer to that. I think it's just presumably tied up in the response you get, and they've obviously done the trial work to show that one is not effective, and the booster dose gives you 95 or 90% effectiveness. So it's tied up in the clinical trial work that they've done. Yep, absolutely, and we're seeing that the rollout is happening quite smoothly. I think I'm seeing more and more people now saying that they've had their second vaccine overseas. So the processes there are working. Yesterday, I saw that Dolly Parton, who of course made a huge donation to one of the vaccines that was developed in the States, had her vaccine and sang a song about it as well. So wouldn't love her more. She changed the words to Jolene to vaccine. Search for it, find it, it's good. All right. Now, we've still got questions coming in, but I think, Neale, let's talk about people who are feeling a little bit hesitant, because I think sometimes, and I know that I'm quite guilty of this, I'm very dismissive, and I know vaccines are safe, so everybody else should in my mind. But we know that there are people who are concerned. Where would you suggest that they turn for some information if they would like some of their questions answered and we haven't managed to get to them today? Well, not to social media, I think, is the first thing I would say, because I think there's a lot of misinformation. But, I do think there are some good websites available, approved websites. So we've got some information on our website. There's obviously Australian Diabetes Society, ADA, all those sort of groups. and the government websites, and they're very informative actually, and there's some good videos on there. And I think also ask your treating doctor, your GP. Most of my patients will come in and actually ask me what the science means, and I think we'll give you a pretty balanced answer to the question. I understand hesitancy, I really do. This is new, and we don't have many cases in Australia, but I think we're trying to really move forward like the rest of the world, and make sure this isn't an ongoing issue. So, and certainly diabetes, I'll just remind you all that diabetes is a high-risk situation. It doesn't mean you're more likely to catch it, but 3 or 4 times more likely to have a bad outcome, death, hospitalisation, whatever. So, I would take it reasonably seriously, and I think that we're very fortunate in this country. Most countries are queuing up because they've got thousands of cases and they really want to get vaccinated. We've been fortunate to really control things well here, but I strongly urge people to particularly chronic disease, to go and get this.
And Diabetes Australia absolutely says the same thing. We support and encourage people to have their flu vaccine every year. And, we have very much the same messaging with COVID. I think it's very, very important. Now, I also, I think though that the point that you made about social media is interesting, because people will turn to social media. And so I find something really useful, and we need to get better at this, is when somebody says do your own research. That's all good and well, provided that you understand that the research sources that you're going to are reputable. So, if you're seeing things that are claiming all sorts of, think you're going to turn into a giraffe or something if you have the vaccine, ask for the source. And I'm pretty sure that there won't be a reputable source. But you can be reassured that if you come to Diabetes Australia, if you go to Baker, if you look at the American Diabetes Association, if you look at JDRF, ADS, ADEA, everything there is reputable, and we're not listening and reading conspiracy theories that have absolutely no basis in science. And that's really important for people to know. If you're going to go to social media, keep asking, where is the source? It's not just about vaccines, it's about everything. Okay, now, there are always people who shouldn't get vaccines for medical reasons. Who would we be talking about here?
Well, there's very few groups. I mean, there are precautions in people who are on blood thinning agents, but, because you can bruise, there are precautions in people who've had severe anaphylaxis, like allergic reactions to something. And again, those are people that should come in and be watched carefully. And I know the GPs are loading up with EpiPens in case anything happens. But really, apart from that, it's not been completely tested in the very elderly. But again, they're the sorts of people who are extremely high risk from COVID. So I think on balance, I would encourage these groups. Diabetes is mentioned, but it's really... it's mentioned, I'm not sure if it's even mentioned as a precaution, but really the diabetes groups are high risk and absolutely should be completely encouraged to get their vaccination. Immunosuppressed patients should discuss that with their doctor. But again, there's no reason to think it's harmful. It's just efficacy. So all these groups are high risk and they should be vaccinated. So there's very, very few groups, except children. Of course, we know children are not included. Yeah. Maybe if you are actually pregnant or breastfeeding, you may want to discuss that with your GP as well. And that'd be very reasonable.
Absolutely. And we would definitely recommend that people do that. Okay, we're about to wrap up. So if we do have any questions, please do. You've got probably a minute to fire them to us so that we get them. But I guess now let's just talk about that, overarching message that we have here. I know that we probably said it a million times, and I know that I'm going to be continually saying it until we are all, we have a huge, huge percentage of the population vaccinated. But what are we saying here? When it's time for people to get vaccinated, when we get an invitation from our GP or from wherever it is, what do we do?
Please go. I think, we want you, my only interest is everyone's well, and my patients are fit and well, and I'm sure Diabetes Australia has the same interest. I have no vested interest in pharmaceutical companies or anything like that. I'm just wanting people to go along and rest assured, if anything comes up that we're concerned about with the vaccine or any adverse events that we're worried about or specific to any condition, these will make headlines pretty quickly. But I'm very reassured on what I've seen so far. So please go ahead, have the vaccination, line up for it when it's your turn.
Great, thank you. Sorry, somebody's just shown up to my door and my dogs are being a welcoming party for that. So I'm sorry about the barking there. Look, this is terrific. So can I just say to anybody, please, if you have any questions, you are very, very welcome to message Diabetes Australia, and we can absolutely make sure that, that we can answer those. Keep an eye on our website, keep an eye on Baker's website, keep an eye on the COVID vaccine website as well, because that's where things will be updated very, very quickly. Thank you so much for joining us today, Neale. I could talk vaccines really, quite frankly, all day, but I'm sure that you've probably got people with diabetes who would like to see you. But thank you very, very much for joining us.
Pleasure. Thanks, Renza.
Thank you. Next week, we have a Q&A, and we are not talking about type 1 diabetes. We're not talking about type 2 diabetes. We're not even talking about gestational diabetes. We are talking about other sorts of diabetes, because often we just completely forget that that diabetes doesn't fit into these nice, neat pigeonholes. So please join us. Keep an eye on our Facebook page, because we will have details of the time and the speaker for that. If you have friends who you think who have missed this, but you think that they really should watch it, this will be left on our Facebook page and you can watch it anytime you like. You can rewatch it again if you've already been here today. But thank you so much. Very, very topical, very, very important topic. So thank you, Neale, for joining us. And Emily, thank you very much. We can end the broadcast.